Well, we've been doing the health clinic all day today with Wefwafwa. You must be getting pretty tired. It's 6:25.
Yeah, it has been a very great day. We have, I think we received over 700 patients today. And yeah, it has been tiresome, but also very good, exciting to see that many people have been able to get help.
Now baby Catherine, little girl's come in and she's got really quite a nasty abscess. And I think you're going to incise this to get the pus out. And of course with abscesses we don't want to cut it too early because it won't be consolidated. We don't want to cut it too late because it can track. So do you think this is just the right time to incise this abscess and get rid of this nasty pus? When there's pus about, let it out.
Yeah. When you look at the site, it is swollen, very tender, and it's visible. You can really see that it is ready, just wants to come out. We are just going to do a very small intervention, but it's going to give a great relief. Because the child is not eating well because of that, and the mother has already told me that she's finding difficulties in having to sleep at night because of the pain, and it is also causing generalized body fever, which may tell us that the body is trying to fight something. So if we do that, I think it will give a great relief.
So we've got an area of localized infection which is causing systemic adverse events and is actually potentially dangerous condition for this child. If we get rid of this pus, so you can give some local anaesthetic, you'll make a cut, you'll get all the pus out, and then how will you clean the wound after that, after you've got the pus out?
Yeah, so what we are going to do, after getting the anesthesia, we'll cut it out, and we shall use like saline to try to wash it out, or we can use maybe hydrogen peroxide when it is dirty initially, to ensure that everything inside is killed and then all cleared, and then we will clean it thoroughly, and we can dress, maybe we can leave inside there gauze that is having maybe iodine or anything like maybe metro, to just be there to soak the remaining pus or anything, and the tissue will push that out in few days. The body itself.
So we're going to pack it and allow some healing by secondary intention.
Exactly.
And the pain should be relieved. I would say the pain should be relieved immediately, really, when the pressure goes. Do you think?
After excision, the baby will feel there's going to be some disturbance. Maybe when we are just injecting the anesthesia, the pain will be there, but it's going to be short-lived, and it's not as much as the pain that she's getting from the pus being there. So after that, the baby will get immediate relief, and we are not just going to let them go, but we'll also give some painkillers to ensure that between now and the time the anesthesia will withdraw, there will be something there to ensure that the child will have a pain-free night, even until tomorrow, because we have some syrups for pain. We have some paracetamol, have some ibuprofen. Whatever we feel will be good for the child, we shall give, and it will change. And we shall also give some antibiotic cover. We know that when we disturb the tissue like that, there is potential of infection spreading. So we don't want to give it a chance. We will give some prophylaxis to help to prevent any infection. And we shall just educate the mother on how to keep that site clean, and hopefully the child will heal.
I'm sure he will, but I think you're quite right. When you're disturbing the tissues, some bacteria are going to get into the blood. So you're going to get at least a low-grade bacteremia. And we don't want that to develop into septicemia, so we're best to give antibiotics to cover that.
Yes. That is what we want to do, because you can see in the site where it is located, with a child, you know that their body is also very small. In case there is entry of infection into blood, it can spread to the brain very fast, and in a very short time, you can lose a child. So yeah, it will be very important for us to give those antibiotics.
Yeah. Well, I think you've got it pretty well worked out with Wefwafwa. Let's should we carry on with the procedure?
All right, thank you very much. Yeah, we are now going to do the procedure, anesthesia, and then we just cut and see what is going to come out. All right. Thank you.
I know, sweetheart.
I was telling him to concentrate more on the side than the eye.
This is the painful bit.
Yeah.
Namuamba hana abatsa henya.
If we don't have anything here, it's clear we can. Stand out. But it's better than not yet. We're going to plug, eh?
Oh, it will work.
Yeah, it will.
It's as if it's wrapping already. It's a strong boy.
Stronger. Why, buku the house hana ya. Buku the house. And the home shall
Salvador.
we wanted. Yes. We wanted something for.
Artery
Yeah. Sorry, family le ku. Family le Yeah.
Yeah, you can enter with a syringe. You can just irrigate it with some saline.
Yeah.
Have we got any towels?
Yeah, they're bringing just more gold.
Pain's less already.
Yeah, it is. It's just psychological. He's just crying because he thinks there is a problem, but there's no pain now.
Yeah, but the pressure, well, there'll still be some, but the pressure will be much less.
True. Yeah, it feels better. True.
It was quite high pressure abscess, that.
Yeah, true. Wow.
You could do with some towels before the anaesthetic wears off.
So the anesthesia can hold on for like how many minutes?
Well, if it's lignocaine just on its own, not too long, 15, 20 minutes.
Oh,
If it's lignocaine with adrenaline, it will last for much longer.
okay.
But that was just plain lignocaine, so 15, 20 minutes.
10 minutes. You should be.
So if you can get it all done within 10 minutes, that's better.
Rather use the 10 minutes.
She's better already.
Yeah. It's feeling.
That high pressure is really painful.
They don't have an artificial centrifuge. Use the single holding.
Is it clean?
Yeah.
Yeah, that's fine. That's fine, yeah. Then just irrigate it with some saline. And have we got any weak hydrogen peroxide?
Yeah.
10, 20 volumes. Is that?
We are going to mix it here.
Oh, okay.
Anyway.
About
Also
20 volumes.
Put it on a gauze.
Yeah.
You can put it. You can wet it.
Yeah.
It goes with the hydrogen. Then we
Yeah.
It's already hydrogen.
Oh, how satisfying! She's better already.
Yeah.
It's wonderful.
Sorry.
Nearly better already.
Yeah.
And you'll have to change the dressing tomorrow
Yeah.
because it will dry out.
If you can cut.
Well, as you'll see, we've now returned from that trip in sunny Uganda to the rather cold north of England in December. Now, that was just an example of the sort of work that was being carried on at the medical camp. Most of it was of a more medical nature than that, giving medications and advice and things like that. But that's an example of pathologies that are so easy to treat and can make such a difference. Now, if that hadn't been treated, it could have been a life-threatening condition and the child would have gone on in pain for quite a long period of time. And I know it's not an easy thing to watch. It's always horrible when you have to do things like that to children. But as soon as we finished, just before we did it, her arm was like rigid. It's called guarding. So she was guarding the pain. After which she was moving her arm. You know, the pain and relief was instant. Now, we show this not as an example of how to carry out clinical procedures. Of course, you would do it slightly differently in a sophisticated Western facility. But it worked. We let that pus out that was causing the pressure and the abscess and the incredible pain. Now, after that, we packed it with iodine, gore swabs and iodine. Well, actually, after that, I'm not sure if we showed it, but we irrigated it with saline to get as much pus out as we could. Then we irrigated it with low-strength hydrogen peroxide, which donates oxygen and kills all sorts of bugs. Very good for cleaning, but prevents wound healing. So to use it once is good. Cleans out a lot of the bugs. Then we put in iodine, packed it with iodine. You've got to pack all the little crevices, because if you don't, you can get little bits like where there's a hollow, like a cave inside the tissues, and infection can grow there and generate another abscess. So we packed it, and that allows it to heal from the outside in, what we call healing by secondary intention. Although there will be some primary healing there as well. With iodine, the reason we use iodine is iodine kills all bacteria, all viruses and all fungi. It kills the lot and keeps the wound clean. Because if that wound isn't going to heal, the main reason for non-healing is likely to be infection. So we want to get rid of the infection by getting all the pus out, by irrigating with saline and hydrogen peroxide, and by putting iodine packing in. The iodine packing was changed for the next few days, and the latest report is the child is making completely full recovery. I'm hopeful she'll be left with absolutely minimal scarring, and it won't, the Wefwafwa was pretty convinced it won't affect breast formation when she becomes pubescent. So simple procedure, costs a couple of dollars maybe, but transformative and potentially life-saving, but certainly saving several other weeks of pain. If we hadn't intervened, eventually, maybe after a week or 2 or 3, I'm not really sure, because the ones I've seen, we all intervene, but eventually, maybe it could be weeks later, it would have burst. Now, in the meantime, it could have caused more systemic infection because she was getting ill already. That could have caused things like meningitis and kidney problems, potentially life-threatening. But the pain would have gone on. But eventually, if the child had survived, it would have burst. But then, because there was so much infection, you'd be potentially left with huge amounts of scar tissue. It would have been thoroughly unsatisfactory. So a very effective, very simple intervention. One of many. So that was that video and my thoughts on it. We did tell you that I'm probably still a bit jet lagged or a bit demented. I think I told you we made an outro, but we lost it. But anyway, that's the update from that. And the latest report is I will be checking again, obviously, but she's doing very well indeed. And of course, thanks to Mum for giving us full permission to use this video of herself and her daughter. Thank you for watching.